Welcome back to Therapy Tip Tuesday. My name is Alexis, and for the next few weeks, I'm going to share some therapy tips with you. I currently work in the Farmingville and Islip offices. May is Better Speech and Hearing Month, so I'm going to share some tips on how to protect your hearing, discuss the structures of the ear, and why children are prone to ear infections. So let's look at the ear's anatomy. This is the outer ear. We have an ear canal and a tympanic membrane, which is also called the eardrum. Sound is caught by the outermost part of the ear, travels through the ear canal, and moves the eardrum. Our ear canal is where wax is made. Earwax is important because it prevents things like small bugs and dust from entering our ears. Wax can also build up and impact hearing. So how should we safely remove wax? The good news is that our ear does it for us. The little hairs in our outer ear will gradually move the wax out of the ear. The safest way to remove wax is using a damp washcloth after a shower. Q-tips will actually push wax back into the ear, creating excessive buildup, and can damage the delicate structures of the outer ear. So because Q-tips do more harm than good, it's recommended that you let your ear take care of the wax removal and use a washcloth to remove visible wax. Next up is our eustachian tube. This structure is home to the body's smallest bones, the malleus, the incus, and the stapes. The eustachian tube's job is to protect the middle ear from unwanted pressure changes and loud sounds. This might be that popping feeling you feel when you're traveling on an airplane. The eustachian tube looks a little different in adults than it does in children. In children, the eustachian tube almost lays flat, where the adult eustachian tube has a downward slope. So what does this mean? Those three little bones that I talked about earlier that are housed in the middle ear, they help move sound from the eardrum to the brain for processing. When we have fluid or infection in that middle ear space, those bones can't work as well. This is called a conductive hearing loss or a temporary hearing loss. This can be treated with either medication or placement of tubes in the ears. Many children pass their newborn hearing screening, but that doesn't mean they won't be prone to ear infections or fluid in the middle ear. It is especially important that you have your child's hearing tested every year with your primary care physician, as conductive hearing loss can lead to speech sound delays and language delays, because speech and language sounds like you're underwater. Lastly, let's look at this snail structure called the cochlea. This structure sends sounds to the brain. Inside the snail structure are little hair cells. When sounds pass through the ear, it pushes on those cells and sends sound to the brain to be processed, almost like pushing keys on a keyboard. These hair cells can become damaged, and when we're exposed to loud sounds for an extended period of time, these cells become damaged. Unlike other cells in our body, these cells do not heal themselves. Once they are damaged, the damage is permanent. This is called a sensory neural hearing loss. So what can we do to protect these little structures? First up is ear protection. There are different types of ear protection. Often we think about workers who wear ear protection while operating loud machinery, like airplanes or like jets. There are even smaller types of ear protection that you can wear in places such as movie theaters, restaurants, and concerts. These are called musician headphones. And what these basically do is reduce the sound so that it's not as loud, but the clarity is still there. So sound sounds really clear, but it's at a reduced volume. These environments, such as movie theaters, restaurants, and concerts, can be too loud for the hair cells and cause damage. Think about when you go to like an IMAX movie and the movie theater seats shake. It's just too loud. So musician earplugs are designed to reduce that loudness while maintaining the quality of the sound. These are great for children and adults and can be used in places where the volume is too loud. Lastly are music headphones. While AirPods and headphones have a sleek design, they don't cancel out competing sound. So when you're trying to listen to music and you hear a lot of background noise, what do? You turn up the volume. Again, this is not healthy for those little hair cells. And if you keep it loud for a long enough time, you're going to cause damage. So noise canceling headphones are a better choice because when you're listening to music, you'll have it at a lower volume because you're not trying to block out those competing sounds. I hope you found this video helpful and learned some new ways to protect your hearing. See you next week.